Hello everyone, I'm Nathan Jones, and today I would like to talk about the prospect and the policy of healthcare being universal for all. As always, this is my wonderful audience, my dad and mom. Let us begin. The purpose of this speech is to gather necessary attention needed for the prospect of available universal healthcare. I want you to imagine a world in which every individual has the access to quality healthcare, regardless of financial status. This is a world that universal healthcare can create for all and what it aims to achieve. I know many of you have learned or endured financial hardship due to medical bills, and like many of you, have witnessed the effects that high medical bills bring to many families. Let us explore a world in which healthcare is universal for all. The prospect of universal healthcare, despite financial status, is a world that is both prosperous and advantageous for all. To outline the many aspects of universal healthcare, we must look at the importance of universal healthcare, the debate surrounding the topic of universal healthcare, and why the United States needs to think about universal healthcare. Let us shift our attention to the importance of universal healthcare and why it is such an important aspect within the world. First and foremost, universal healthcare ensures that each citizen has the access necessary to health services. Many universal healthcare systems remove common barriers to more timely medical attention, as most access to doctors, hospitals, or treatments are blocked behind walls consisting of income, employment, or pre-existing conditions. However, with universal healthcare, these aspects are eliminated, and the people can seek healthcare when in need, according to legal clarity and the balance online. It also contributes to a healthier population by promoting widespread access to preventive care and early intervention. With more access to doctor visits, now without the burden of financial burden and stress, this can allow for diseases to be caught at a much earlier stage before they become too life-threatening or require too much costly care. This also allows for a more equitable for a more equitable society by reducing disparities. Much of our current system is determined by socioeconomic status, race, or geographic location. With more equal access to healthcare, medical services are not locked behind a wall of wealth and social status. Universal healthcare has the potential to wield economic benefits beyond the individual. With a healthier workforce, work output for businesses is increased and contributes to a more robust and dynamic labor market, according to the Matthews Open Access Journal. Universal healthcare has shown its clear advantages, but what is the debate over the topic? What is the conversation of universal healthcare, and what is the driving force behind it? The debate of universal healthcare within the United States does have a deep historical tie dating back to the early 20th century, with efforts to provide medical services for low-income workers. Famous presidents, for example, Franklin D. Roosevelt and Harry S. Truman, made strong proposals to expand healthcare, yet faced heavy opposition from stakeholders from various medical establishments and businesses, using the fear of socialism as opposition. Even more presidents, including Nixon, Clinton, and Obama, have offered ideas to reform to move to universal health care, yet were met by the same opposition from various stakeholders that wanted to maintain the status quo. Though opponents raised concern that the government would become inefficient, taxes could increase, and potentially cause a decrease in quality care, the public opinion has shifted into a more positive viewing of universal health care, arguing that health care should be a basic human right, and that a centralized system could help address many inefficiencies and gaps within our current system, such as according to the Health Point. Now that we have seen the arguments for and against the universal health care, let us discuss why the United States should heavily consider the idea of universal health care. Many of advanced and challenged countries provide universal health care to their citizens, but why hasn't the United States, a top country within the world, advocated for change as well? Well, according to the Health Organization World Health Organization, many countries have implemented government-funded universal healthcare systems, which ensure both high quality and affordability. Many countries have blended forms of public and private systems that maximize access, equality, comprehensiveness. For example, South Korea has implemented a universal healthcare system that covers to over 60% of all medical expenses, and it allows individuals with insurance to cover over 77% of the remaining expenses. Dozens of countries have different forms of universal healthcare policies in place that varies greatly from country to country. For example, in the UK, they have a completely free healthcare system provided through the public facilities owned by the government. Germany has government funds that pay for coverage from both from private doctors and hospitals. Brazil, however, has been considered the model for universal health care, as many people as any person in Brazil, whether they're citizens, travelers, tourists, refugees, or undocumented immigrants, have the eligibility for free and immediate medical care, according to the World Population Review. We've now covered each prospect of universal health care and have gained an adequate understanding of what it is and what it can provide. As shown, we have gained a full understanding of universal healthcare from its importance to the debate behind it and what other countries define as universal healthcare, and why the United States should show more consideration towards the universal healthcare. I hope those who have listened and those who understand universal healthcare learn more about its importance and why it becomes essential to us as a society to advocate for its implementation within our own country. These are my works cited.